In this session of preventive cardiology, we're going to discuss a particular class of medications proven to reduce the risk of heart attack. They are called bile acid binders. The major effect of a bile acid binder is to lower LDL cholesterol. This is achieved as the medication actually locks on or binds itself to cholesterol in the walls of the stomach and intestines. Once it is accomplished, the unhealthy cholesterol is safely eliminated from the body. The major advantages of bile acid binders are they are not physically absorbed into the body. They have a long history of use, and all side effects are well known. Of course, the most important advantage of these medications is that they are proven to lower the risk of a heart attack. In the well-known Lipid Research Clinic study, 3,800 normal men who had cholesterol levels averaging 290 points were split into two groups. Half received bile acid binders, while the other half received a placebo. During the first 2 years of the study, there was virtually no difference in the heart attack rate between these patients. But notice the fourth year. The difference between those who received medication and those who received placebo becomes very apparent. As you look at the upper right corner of this graph, you can see after 9 years of therapy, there's a 24% reduction in risk of having a heart attack or dying of a heart attack between the two groups. In this study, for every 1% LDL was lowered, there was a 2% reduction in the risk of having a heart attack. Clear evidence that bile acid binders are not only effective in lowering cholesterol levels, they are also effective in reducing the risk of having a heart attack. Bile acid binders have very little effect on HDL cholesterol levels, and in some people can cause an increase in triglycerides or VLDL cholesterol. And there are several other disadvantages to the use of this medication. Bile acid binders are gritty like sand. Many people note an unpleasant sensation when swallowing this medication. Another disadvantage is that bile acid binders tend to cause constipation and associated abdominal discomfort. So much so that 1/3 of the patients who start this type of medication will stop taking it within a year. However, constipation can be avoided by taking a bulk laxative like Metamucil, along with the bile acid binder. 1 heaping teaspoon of bulk laxative is usually added to 1 scoop of medication. It will take a couple of days to assess this mixture on bowel function. If necessary, the dose of laxative can be increased until the right balance is determined. The dose of bile acid binders should be increased gradually. The maximum dose is 6 scoops per day. The major disadvantage of bile acid binders is that they not only bind to cholesterol, they also bind to other medications. That means if bile acid binders are not taken properly, they may cancel the effectiveness of other medications you may be taking. To prevent this from occurring, bile acid binders should be taken at least 1.5 hours after other medications and no sooner than 4 to 5 hours prior to taking additional medications. If other medications are not involved, bile acid binders are most effective when taken before a meal along with the bulk laxative. Here is the typical effect of bile acid binders on cholesterol levels as published in the Lipid Research Clinic study. Patients who take 2 or 3 scoops per day will experience a 10% drop in total cholesterol, a 10% drop in LDL cholesterol, little or no change in HDL cholesterol, and a slight increase in triglycerides. The final question about bile acid binders is how long should you take this medication? If you take these medications properly and under proper supervision, you will have an improvement in your cholesterol numbers, a reduction in your risk of having a heart attack, and an increase in your lifespan. If the medications are stopped, it's only a matter of weeks before cholesterol levels return to previous numbers. The clinical studies which prove these medications prevented heart attacks lasted from 2 to 9 years. So do you need to take these medications for the rest of your life? My answer is only until you no longer want to prevent heart disease or until you are 95 years old.